Welcome back to Niaga AWANI. At this hour, we're going to shift our discussion towards the topic of healthcare, focusing on cancer care challenges, gaps and opportunities in Malaysia. According to a study by the Gallen Centre for Health and Social Policy, cancer survival rates in Malaysia are below the desired levels, with a 61% mortality to incidence ratio higher than comparable countries. Breast cancer, for instance, has a concerning 5-year survival rate of 67%, and lung cancer is at 11%, resulting in a higher number of deaths. Late-stage diagnosis, accounting for 64% of cases, emphasize the need for improved access to effective treatment. While Malaysia has a lower incidence of new cancer cases, addressing late-stage diagnosis and enhancing disease management is crucial for improving survival rates. So joining me on the line right now is Raman Singh, the CEO of Juniper Biologics. Good morning, Raman.
Good morning.
All right, great. Can you start off by introducing Juniper Biologics and what do you do?
Sure. Well, Juniper Biologics is a biotech pharmaceutical company. We are in the therapeutic areas of oncology, which is cancer care, which you started the discussion with. Apart from that, we are into gene therapy, into rare diseases, and into infectious diseases.
So what motivated Juniper Biologics to focus on specific therapy areas, and how does Juniper Biologics envision to fill in the unmet needs in these areas?
Yeah, well, Juniper Biologics, the genesis of Juniper Biologics has been that I actually in 2020 saw that there was no pharmaceutical biotech company that was focusing on emerging markets. You have a number of global companies, you have a number of domestic companies like Korean companies, Chinese companies, Japanese and Indian companies, but pan-Asian, pan-Middle East, pan-Australia, we don't see much. So that prompted me to start Juniper Biologics, and our focus has been primarily on disease areas where there is a significant unmet need. So oncology was one such space, and that's how cancer care became extremely important to us. And we started the company by acquiring 3 assets in the area of oncology, and subsequently diversified into gene therapy, into rare diseases. And today I have almost 7 products in our product portfolio.
So speaking of which, as oncology and oncology supportive care are a part of Juniper Biologics' focus areas, so what are some of the existing gaps or challenges in cancer care, especially in Malaysia?
I think one of the biggest challenges in Malaysia is diagnostic. In fact, by the times we identify the patients in Malaysia, it's significantly late. It's typically a stage 3 or stage 4 cancer. And if you look at Malaysia, some of the leading cancer care in Malaysia, or cancers that are prevalent in Malaysia, are breast cancer, lung cancer, colorectal cancer. And by the time the patients present themselves, they are in a state where they actually have a limited number of years before which the cancer would take a lethal turn, or would find themselves in a situation where they need access to care which is significantly innovative drugs which are not available in markets like Malaysia. Typically, these drugs are extremely expensive, and the public hospitals in Malaysia don't cater to such drugs. So those are the 2 significant challenges that are prevalent in Malaysia.
So how is this cancer drug shortage and inaccessibility to novel therapies in Malaysia posing a problem for both patients and medical professionals, and how frequent are these problems now?
So typically, if you see, just to give you an example, if 100 new drugs as approved by Food and Drug Administration in the US are available in Western world, only 15 of such drugs are available in markets like Malaysia. Typically, the problem has been that 1, the regulatory environment is quite complex. Secondly, the pricing of these drugs make it very, very difficult for patients to have an access to these drugs. And thirdly, because the public hospital systems are quite constrained, there are a lot of limitations in number of beds available, number of healthcare providers available. Hence, the focus of these hospitals are more on prevalent cancers like breast or lung, And typically the rare cancers are deprioritized because they just don't have the time or the resources to take care of it.
And while overcoming cancer remains challenging and involves a complex journey from diagnosis to survivorship, often spanning months to years. So what are some of the solutions in oncology and oncology supportive care currently available in the Malaysia market, and how is Juniper Biologics filling in the existing gaps?
So I think we as a company have taken the diagnostic testing as a part of our portfolio. So we actually have products that are from diagnostics till treatment. And we believe by combining the two, it facilitates not only in terms of early diagnostics, but also then making sure that the right medication is administered to the patients. And that's why the diagnostic becomes extremely important, because it not only helps to figure out the kind of cancer that the patient is suffering, but also it helps us to determine which therapies and which drugs would actually work for that patient and which would not. And hence, what we are trying to do is we are trying to make sure that we start with testing, we kind of detail the results to the patients and healthcare providers, and then have the appropriate medication that is made available to the patient so that they can get treated.
Raman, can you elaborate more on molecular profiling and how can carriers molecular profiling address drug shortages and lack of personalized therapeutics, and also thereby improve patients' quality of life?
Caris molecular profiling is quite a game changer. In fact, in the United States alone, if you compare on diagnostic testing, Caris has got a market share of over 60%, by far is a market leader. It's the most comprehensive tumor profiling diagnostic test that's available. Just for the sake of simplicity, when a patient presents themselves to a hospital or to a healthcare provider, before a medication gets prescribed, a tumor profiling is done to ensuring that the DNA sequencing of the patient is formulated, and we determine the drugs that will actually work for that patient and the drugs which will not work. Hence, it actually kind of initiates a personalized care that the drugs that are prescribed to the patients are the drugs that actually would generate results, which would significantly impact the quality of life of patients.
So moving forward, are there any other expected opportunities and trends in oncology and oncology supportive care in this market in the upcoming year 2024?
Yeah, absolutely. In terms of supportive care, Juniper is bringing a product called anamorolin, which is chemotherapy-induced cachexia. That means patients who are actually doing chemotherapy, weight loss is a big side effect. So we are bringing a drug which will actually take care of appetite so that appetite does not get suppressed. We are also bringing forward a drug for cancer, which is a rare disease, which a number of patients that impacted are fairly small, but patients have no choice. So we are looking forward to even bringing that drug next year to the Malaysian market. And we are also then working towards gene therapy, which is for osteoarthritis of the knee. So there is a significant pipeline that Juniper is currently working on.
But Raman, are there any relevant business updates or projects in the pipeline for Juniper Biologics? And what are some of the goals set for 2024 that Juniper Biologics intends to achieve?
So one of the key initiatives that we have taken in Malaysia is to make sure that our drugs are available not only in private hospital, but also in public hospitals. We know that 3 out of 4 patients in Malaysia actually go to public hospitals, and Juniper as a company has created a strategy where market access has become a significant importance to us, that we want to price the drug that is more affordable so that the public hospitals can get access to innovative care that we have. Both Caris as well as some of our oncology drugs, we are making sure that we go through the Blue Book listing, which will basically bring the access to care to public hospitals.
All right, thank you so much, Raman. That was Raman Singh, the CEO of Juniper Biologics, for helping us understand more on how we can advance our cancer care with precision, deliver targeted treatments for enhanced efficacy in Malaysian oncology solutions. Thank you so much.